Shadow Health Secretary. Good morning to you.
Good morning.
First of all, can we start on a positive note? This prospect of a vaccine human trial starting tomorrow at Oxford University, and a team led by Sarah Gilbert looking into a vaccine. Those human trials, normally you'd be looking at 5 years of work before you get to that point. She says she's condensed it down to 4 months. How hopeful are you?
Well, I'm extremely hopeful because we desperately need a vaccine. And in the end, the vaccine is what gets us through this. So we've all got our fingers crossed. We're all willing them on. There is remarkable world-leading research going on in our life sciences and our pharmaceutical base in this country. So we can be extremely proud of that. Let's see where it gets to. I know we'll all have our fingers crossed. But if a vaccine can be developed quickly, that really does change things. So we're all looking forward to hear about progress.
Okay, well, I think it comes especially at news that we needed to boost our spirits after we looked at the news figures from the Office for National Statistics yesterday, which suggested that, certainly looking at figures for England and Wales only, and these, of course, go back to the 10th of April, a couple of weeks ago, that we had one of the highest death tolls for that week ever, and looks like it's 8,000 more, so roughly 40% more than it would normally be. Not all of those accounted for by the official death toll from coronavirus. What do you think is going on?
I think, well, we've always known that care homes and nursing homes would be particularly vulnerable. And I think what we're seeing now is the virus spreading through our care homes. And my worry is that whereas we've had a very good plan to scale up critical care capacity in the NHS and restructure the NHS, and I've got nothing but praise for the NHS leadership and what they've done, I'm not convinced we've had the same level of a detailed plan for our social care sector. So what I'm proposing to the government is that they use some of the same mechanisms they've used in the NHS to get the PPE to care staff, that they test care staff by sending them mobile testing units, but also if they've got residents who they think are coming down with COVID, they should be moved now into some of these empty beds that are in the NHS, because the NHS have been so detailed in freeing up space, they've actually now got lots of empty beds which could be used. So unless something like that happens, I'm very worried about what happens next in our care homes.
Well, indeed. I mean, again, a lot of us will have elderly relatives, as I do have, in care homes where they had a positive COVID-19 test, and those people are still in the care homes.
Well, exactly, and I think you have to move residents out because it stands to reason that the COVID would spread quickly around a care home. And the figures that we saw come out yesterday about deaths in care homes were heartbreaking. I mean, so many families will just be sort of shattered across the country knowing that their loved one elderly relative died from COVID-19. But of course, there's a time lag in those figures. Those figures are from 10 days ago, so we don't actually have daily figures for care homes. I'm very worried that when the next set of figures come out, we'll see even more deaths.
Well, talking about, testing, that's absolutely crucial. We don't know if someone's died of or with coronavirus or if they're a risk to other people unless we do have that testing. The Health Secretary Matt Hancock was at the Downing Street briefing yesterday, and he revealed that we're now seeing testing capacity, keyword there, capacity, now 39,000. But on Monday, the latest day, we got figures for only 19,000 people getting tested. Since emerged, Helen Whately, the Health Minister, this morning has said that actually some of the tests that were carried out on particular NHS staff early on in the early weeks are now thought to have been faulty, and therefore people have been written to and asked to come and retake another test. They may have had a false negative or a false positive. Both of those, of course, are a big risk. What do you think's gone wrong with testing? And more importantly, trying to be constructive, what can we do about it now?
Well, I think part of the problem is that early on we tried to centralise testing through Public Health England. That's the organisation that is responsible for testing. But rather than try and use all the different labs across the country in both hospitals and in research institutions and indeed in our pharmaceutical industry, and that is actually something that we were calling for early on in this. I think that really has to be done more now. It's beginning to happen, but we really need to speed that process up. But it is worrying that we've heard that some of our testing was faulty. This emerged because a document was leaked, I think, yesterday, highlighting this. So I hope we can get some clarity from ministers today on how many people have had this faulty test and what the plan is now, because there'll be lots of people who will be extremely concerned that perhaps they were told they were COVID negative and then went back into the NHS to work. That's quite serious, so we need to know all the details.
Okay, let's also talk about PPE. Now, we know finally this plane load of items, we're told including 400,000 clinical gowns, which will be vital, has arrived at RAF Bryce Norton from Turkey this morning. Seems to have been quite a lot of messing up by officials there. They ordered equipment, didn't check it could be exported. Turkey, like most countries, has restricted exports of vital equipment. We in this country, bizarrely, haven't restricted exports. And we're hearing again and again stories of companies that say, we've got these goods in stock, we've got warehouses full of the stuff that we've brought in. We've offered it to the government. The government haven't even bothered replying to us, and now we're going to export it. This is obviously a very grave concern to everybody listening right now, but also particularly of concern to those medics who are putting their lives on the line, working in NHS hospitals and in care homes without the proper kit.
Yeah, I mean, this is so frustrating, and so many firms get in touch with me, emailing me, saying they try to offer the government PPE kit which they can supply. Either they can manufacture it themselves or they work in procurement and they can get hold of it. They've offered it to the government and they've heard nothing back. I in turn have sent off these emails to the government, and again have heard nothing back. And this is a bit which a lot of people just don't understand, is that you've got firms out there, British firms, who want to get their production lines up and running, who want to help out in this national crisis, and we should be mobilising them all. We keep raising this with the government, and the government ministers keep saying what they say at the press conferences, as you know, but at the same time we then also hear that NHS staff on the front line don't have enough kit. So
yeah, but do you have any sympathy though? The government, I mean, Matt Hancock said, look, they've got more than 8,000 offers. I mean, that's a lot of offers to work through. Some are bogus companies that are just set up the day before, and they don't know which ones are real, which ones aren't, and they're having to work their way through. Do you have any sympathy that actually this has turned into something of a bureaucratic nightmare?
Oh, I can see it's a huge project, but there's thousands of civil servants who could be switched over to this. There's lots of civil servants working on other issues in departments. And of course, the country has to continue running, but they must be able to mobilise some civil servants to chase up all these different messages.
Okay, well, let's talk about civil servants in particular. The Permanent Secretary of the Foreign Office, Sir Simon MacDonald, he's most senior Mandarin in the Foreign Office, Dominic Rubb's department. Yesterday, he told a select committee that the UK didn't take part in an EU-wide scheme, including actually lots of EA countries as well, to basically bulk buy ventilators and all the PPE they need. He said it was because it was a political decision. Those were his words. Now, previously, we've been told, look, actually the government had missed some emails, and there was a bit of a problem, a bureaucratic mess up. Yesterday, Matt Hancock was asked about this, and he said no, emails had been missed. The government had now signed up to this scheme, and that it was not a political decision. Later on, the Permanent Secretary wrote to the committee saying he'd been mistaken. Inadvertently, he'd got his information wrong. Information hadn't been passed on from Brussels to ministers. But of course, the crucial fact here is, and this people obsessed with this scheme seem to almost entirely be those who wanted us not to leave the EU at all. A, we are not in the EU anymore, and B, not a single item of this bulk buy organised by the EU scheme has actually turned up on the front line in any country whatsoever. In which case, why is there such a big row over this?
Because I think it's just confusing, isn't it? The government seems to have changed their line every time they're asked about it. First they've missed a few emails, then it's they didn't want to be in it, then they did want to be in it. But I just take a pragmatic approach. We should be using every avenue to try and get this, to get the equipment that we need, to get the PPE that we need. If there was an opportunity, we should have been part of it. We now apparently are going to be part of it, but again, it's one of these.
But it hasn't delivered. It hasn't delivered any actual PPE. I mean, this is this amazing scheme because, of course, the EU can bulk buy and they've got all this buying power, and not a single item has been delivered to a single country as a result of this scheme and bulk buying. Doesn't that tell us that actually the original, whether it was a decision or not, but the original, even the failing to sign up, actually wasn't necessarily a bad decision?
Well, presumably the scheme will eventually deliver. And my view is, when you've got so many shortages, you should be using every possible, taking advantage of every opportunity you're presented with. I mean, I don't come at this because of the sort of pro-EU or anti-EU sort of approach. I think that debate's been, is done and dusted. I just think that when you're presented with opportunities, you should take advantage of them.
Okay, and in terms of anything that you're going to be wanting from the government in the coming days, the answers that you want, the actions that you want, that you think should be prioritised, what are they?
I think we need to understand where we're going on testing and how we're going to scale up testing. and also what now is the plan for getting PPE, whether it's from the European procurement sources or other sources, to the front line, and how we're going to support those in care homes and nursing homes.
Okay, thank you very much indeed for joining us.